Hi, this is Professor Sarah Sears. Today we're going to do a respiratory review for your nursing health assessment lab. So what's really important in the next two stations with respiratory and cardiac is that you know where to put your stethoscope and you're able to properly place it. So landmarking is really important here. So in class we've got a PowerPoint we'll look at, but when you're looking at your patient, you've got to be able to mark all of your lung lobes and tell me what they are. So it's really important to keep the right side of the patient straight from the left side when you're doing this one. So when we look, we have to assess the different lobes. So we always go across, then move down to the next lobes. The first lobe that we're going to do, it does not make a difference to me if you start on the right or left side, just go in the correct pattern. So if I was going to assess the left upper lobe, it actually starts just above the collarbone right here. But typically for class, we're only going to measure 3 on each side. So if you go right in here, this is right in the middle of that upper lobe, okay? When we do the middle lobe, there is only a right middle lobe because the left side, the heart takes up space in that part of the chest. So we don't have a left middle lobe, only a right middle lobe. So the right middle lobe starts about the 5th rib and it intersects over here on the side. So when you look at the stereotypical male example they present in the textbook, it's right about nipple line if you go right next to the sternum here. You want to make sure you're not putting your stethoscope right over bone like the sternum. You won't be able to hear your sounds very well. And then we have our right lower lobe and left lower lobe. So those are underneath that. So they're easy to get to right here, but you can also assess them on the sides here. And then we have our posterior lobes that I'll show you in a second. So basically, if I was going to do a stethoscope to listen to lungs, which I can't hear my own, but I would be placing the stethoscope, big breath in and out, move the stethoscope, deep breath. Good, and those are both upper lobes. So if I listen here, you can kind of displace the breast tissue, but deep breath, this is still a left upper lobe. When I come over here, now I'm on the right middle lobe. So deep breath. Good. I'm going to check my lower lobe and lower lobe on the other side. Okay, make sure that you give your patient enough time to take a big breath in and out and that you hear it. If you need him to repeat it, just ask him to take another breath while you're listening. For the posterior lobes, I'm going to show you on the mannequin here. But again, our apices, the top of our lungs, do extend just a little bit above the collarbone. But typically when you're listening to your patient, if you're only listening to a few spots, like we just have to do 6 spots total on the back, 3 on each side, you can go ahead and just start kind of like right here. This is some easy real estate to listen to. So when I listen to my patient, okay, I can place my stethoscope. Now, the upper lobes, if you count from C7, which is that prominence right on the bottom part of your neck right here, C7 to T3, that little bit of space that we have, that's where your upper lobes end. So you need to be careful when you're placing your stethoscope. On the back, we also have our scapula right here. So you have a little bit of space between the spine and the scapula. You need to put your stethoscope in that space. You can't listen right in the middle because that bone, you won't hear any lung sounds over that. So when I'm listening here, I would go ahead and do my patient's left upper lobe, right upper lobe, and then I can do right lower lobe, left lower lobe, left lower lobe, right lower lobe. So for you guys, it's fairly simple. You only have to do 6 on the front and 6 on the back. So you can choose where you want to do. Just make sure you listen at least one time in every single lung field. Thank you.